Well, I'm Alan Dale from Gale Force Winds. What a pleasure it is to be here. Downtown St. John's at the Keyin campus. Keyin College, of course, is right across this wonderful province of Newfoundland and Labrador. And these folks are making a difference. They're finding a better way. They're making such a positive impact on our communities. And they really are making a difference for all of us. And on that note, I like meeting all the people that are involved along the way. So why don't you introduce yourself and tell us what you do?
I'm Dr. Kathy Watkins, and I'm a registered nurse, and I'm the director of the Center for Nursing Studies here in St. John's, Newfoundland and Labrador, and we are owned and operated by Newfoundland Labrador Health Services.
Okay, so I'm going to need you to break all of that down. It's a big jumble of names and stuff like that. And for the benefit of the audience, explain to me how all those pieces come together.
So the Center for Nursing Studies was opened in 1996 by what was then the Healthcare Corporation of St. John's. And we came together as the largest nursing school in the province. And we came together from 3 diploma schools: St. Clair's Mercy Hospital School of Nursing, Salvation Army Grace General Hospital School of Nursing, and the General Hospital School of Nursing. So when they closed their doors in 1998, because the way forward in Newfoundland and Labrador for a registered nurse was to be baccalaureate prepared. So we wanted to have, by the year 2000, all nursing graduates be baccalaureate prepared. So we opened our doors at the Center for Nursing Studies in 1996. And we were then operated by Healthcare Corporation of St. John's, that then transitioned to Eastern Health, and now Newfoundland Labrador Health Services. So we have a 4-year Bachelor of Science in Nursing program. We have a 19-month practical nursing program, and we have a huge department of continuing nursing studies where we do all continuing education for registered nurses and for licensed practical nurses throughout the province and beyond.
I bet there's many people in the audience that are so glad that you broke all that down and tried to fit together where everything sort of came aligned to create what you are now. Important work that you do. I mean, the amount of nurses that you must put into the workforce must be just absolutely incredible.
Yep. Across the province, we have nursing seats, 363 seats right now for our Bachelor of Science in Nursing program. And that's at the Center for Nursing Studies, at Memorial University Faculty of Nursing, and Western Regional School of Nursing in Corner Brook. And they are also operated by Newfoundland Labrador Health Services. So Newfoundland is very unique. We are the only province in the country that has 2 nursing schools being operated by a provincial health authority.
Wow. I know you're going to be biased on this next question, but tell me how important nursing is to the healthcare system.
Oh, nurses play a critical role in the healthcare system, and as being part of the interdisciplinary care team, where they work with other health professionals to be able to provide individuals with safe, competent, and quality healthcare.
Right. The nurses that you're educating, training, upskilling, and continuous improving now, primarily domestic, or is there international? Is it a mixture of everything?
Primarily domestic. We only take about 10% of our admissions would be considered international students. Yeah.
Wow. I'd like you now to talk about the intersection of what you do there and Keyin College. Talk to me a little bit about that.
Okay. So in 2019, I was approached by Craig at Keyin College and about the possibility of developing an international personal care attendant program. We had a real shortage of personal care attendants in the province at the time. And even though the Center for Nursing Studies, we were not offering that program as part of our curriculum, we had revised the curriculum for the government between 2018 2019. So we were very familiar with the curriculum, and we had done a major curriculum review and revision for them, because it is a provincial curriculum. So that means that all the private colleges and the public post-secondary institution, they offer the same curriculum. So we were delighted to do that. And because we have an international nursing program at our site, we are what the federal government would call a designated learning institution. So we have a DLI number. And that was very important to Keyin, for us to be able to partner, to have that public-private partnership. So we were, really, really enthused about this, and to be able to participate in this. And because we were owned and operated by NL Health Services, they came on board as a partner. Provincial government came on board as a partner. Then the pandemic happened in 2020. Things got slowed down a little bit. So it took us, 2 or 3 years to really get it off the ground because we had a lot of loopholes and red tape and barriers and challenges, but we really persevered, and we were very, very, resilient and diligent, and made it.
Who is that program designed for? What's the ideal candidate for a program like that look like?
The ideal candidate is for someone, of course, because we're having difficulty filling our domestic seats in the PCA program, is for someone who's really has a very strong attraction to the helping professions and really wants to get in that healthcare space. And once they're in that healthcare space, I think the ideal candidate then might even see themselves in another opportunity, whether that would be to go on a career laddering opportunity to become a practical nurse or to become a registered nurse with a baccalaureate degree.
Yeah.
And we're looking for someone who's caring, compassionate, who's honest, who's accountable, who has excellent communication skills and leadership skills, and all of those qualities that we would look for in any member of the nursing family.
You use the word ladder. Explain to me what that means to you.
Okay, so career laddering to me, and I think this is something we need to work on in this province, is for students to have an opportunity to do a program, and then they might say, okay, well, I want to go on and do the next level. And that might be going from a PCA to a practical nurse and maybe then to a registered nurse. So there should be opportunities and systems built in, almost like the subway model where, okay, I'm going into a personal care attendant program. I'm good with that. I'm going to finish that program. I'm going to work the rest of my life as a PCA. Or there's an opportunity for me to get back on the subway and do some more courses and to upskill to become a licensed practical nurse. Right now, those are separate programs, and we don't give any credit. If you are a personal care attendant, we don't give any credit for all of that curriculum courses towards the practical nursing program, for example. And the practical nursing program, we do have a bridging option, but it's only funded for 16 seats a year. And that LPN, that licensed practical nurse, then can bridge to become a registered nurse and have a Bachelor of Science in Nursing.
Wow, and that seems to be like such an immediate thing to focus on because
I think so.
It gives people such opportunity,
yes.
right?
And some provinces have that.
Yeah.
And some colleges have that.
Right.
Especially ones who offer PCA, practical nursing, and Bachelor of Science in Nursing all within the same space.
Talk to me more about the intersection between Keyin and the work you do. Talk about practical nursing. Where are we there?
So the Center for Nursing Studies, since 1996, we have owned all the intellectual property rights of the practical nursing education in Newfoundland and Labrador. And that was something bestowed upon us by the College of Licensed Practical Nurses of Newfoundland and Labrador. They're the nursing regulator for licensed practical nurses in this province. So we broker our program to 9 campuses of the College of the North Atlantic. And because we have a shortage of licensed practical nurses, Craig approached and we thought, okay, well, why not have the opportunity to broker this program through Keyin College and for Keyin College to offer this program. Yeah. So that's been in the works for the last couple of years, and I'm really pleased to say that that program will launch in January. So that required approval, first of all, from the Center for Nursing Studies, and importantly, from the College of Licensed Practical Nurses of Newfoundland and Labrador.
I mean, there's just so many steps in that whole process. Yes. You fly through them with such ease because you know them so well. You're living it. Talk to me about sort of the success of the public-private partnership in this particular area.
Well, I think it's fantastic, especially in a small province like Newfoundland, where we have provincial curriculums. I mean, we don't need to be developing all these different programs in a small province. We have very close partnerships within Newfoundland Labrador Health Services, within the government, within the nursing regulators, and you know, we should be working together for the greater good of this province in terms of health, human resources. So I think it's a wonderful opportunity for a public nursing school like ours, as purely operated by the government, to be able to partner and leverage our resources for the greater good of the province and for all of us and for the people of Newfoundland and Labrador.
I don't think I've ever been in a conversation where somebody has used the word opportunity so much. And that's exactly what you're describing here. It's opportunity for people to sort of be educated, re-educated, upskilled, and to then go into an incredibly fulfilling workforce and doing such a service to society. And on that note, there'd be people watching this and they're wondering, oh, could I do that? Should I do that? Maybe, is this the right time for me? Putting up barriers to learning, right? Talking themselves out of this. What would you say to people sat around the kitchen table when they're talking about this? Can I really do this? Should I do this? What would you say?
I would say to them, apply, come talk to us, and let's look at the admission criteria. And if there's something that they're not meeting the admissions criteria, we can have a conversation about how we might be able to help them meet those, get you there, and get in one of our seats.
Yeah.
I mean, we don't fill all of our nursing seats in the province any year. No, we do not. No, we don't fill all.
There you go.
And there you go. There's opportunity. So we don't fill all our PCA seats. We don't fill all our practical nursing seats. And we don't fill all of our Bachelor of Science in Nursing seats.
And I doubt many people know that.
Maybe not.
Right? So
it's possible that they don't know that. But, you know, we try very hard for recruitment. Our recruitment committees work very, very hard to get admissions, to get, you know, and qualified applicants. And we truly want people who want to make a difference in people's lives. I mean, when you're working as a nurse, you are caring for people at some of the most vulnerable times in their lives. And we need people who are top-notch in terms of giving that safe, competent, compassionate, and ethical nursing care.
Thank you very much for your conversation, and thank you very much for what you do. That's what opportunity looks like right here. Thank you.
Thank you. Awesome.